Tomorrow is the last working day for the team of federal doctors and nurses who arrived last month at Eisenhower Health. This as the number of coronavirus patients has dropped dramatically at the hospital over the last few weeks. But the hospital is still preparing for the upcoming flu season. I spoke today with the Chief Medical Officer, Dr. Alan Williamson. Dr. Williamson, as always, it's great to see you. Thanks for joining us.
Thank you, Peter. It's good to be back.
What's the latest at Eisenhower?
We're doing pretty well, holding our own here in terms of numbers. We had hit our peak in July in the low 90s in terms of the daily census of patients. And now we're seeing pretty steady for the last 10 days, I'd say, between 25 and 30 patients a day in the hospital with COVID-19. So much better situation than in July.
Yeah, that's a dramatic drop.
Yes, sir.
What are the trends that you're seeing with the patients who are coming in?
So we had a trend for a period of time when we were at that peak where we were seeing whole families, particularly from the east end of the valley, with multiple family members that were infected, several of whom had to be hospitalized. And I'm not seeing that any longer. What we really see now is just cases sporadically across the valley with no particular pattern that I can discern recently.
The governor is expected to lay out new guidelines for counties tomorrow, and Riverside County has said that they want to reopen more businesses and allow indoor operations as soon as after Labor Day, so pretty soon. Do you believe that we're ready for this step, or could this be dangerous with the fall and flu season approaching?
Independent of the flu season, it can be dangerous in the sense that if the assumption, which I think is what happened around Memorial Day of the public, is that if we open businesses, if we open restaurants, it means life goes back to normal, then that's going to be a risk. My hope would be that people have learned their lesson and understand that if we open businesses, that it does mean we just have to continue to really be very, very careful about our own protection of ourselves, our family, and our community by continuing to wear our masks, continuing to wash our hands and socially distance. Then I think we can safely begin to open certainly some of the businesses. Restaurants become a little bit more problematic, but I think again with some redesign of how they're able to lay out their tables, we can probably begin to see some service within restaurants. Bars are another story, pretty problematic to reconcile what most people would consider bar behavior with really socially distancing. It gets loud there. People are talking very loudly. Even if you're wearing a mask, you could still propel particles well beyond the 6 feet we typically talk about if you're talking very loudly. So I think we'll have to continue to watch that very closely before we're going to think it's safe to return to bars.
Where do you predict we'll be after Labor Day, and are you concerned that we could see a similar spike to Memorial Day weekend and 4th of July weekend?
Yeah, obviously there's a concern. It's another opportunity for people to decide it's time to get together and party and so on, and that's a concern. Again, I'm just hopeful that people have learned the lessons. We've all tried to convey the lessons that were learned around Memorial Day, that the fact that we try to allow people to have a few more liberties and so on does not mean that the virus is not part of our life right now. And we have to modify the way that we normally conduct ourselves to reflect the fact that we're surrounded by a dangerous virus. So my hope is that over Labor Day, people will remember that, will recognize that we maybe can go out to the park and have a picnic, or maybe we can go to the beach if the beach is not crowded, and spread ourselves apart and enjoy the outside as the summer winds down. But to do it the way that we would traditionally do Labor Day is going to be very, very dangerous.
How is morale right now at the hospital?
So I think morale remains really quite high. We had our deployment from the Department of Defense, which is ending this week. Their last working day will be tomorrow. And we're going to have a nice send-off for them to thank them for coming and helping us, and for just their willingness to help out their fellow American, period, and all the service they've provided at every level in their service in the military. But that certainly was, an important boost to morale to have them here to help. We've also received some accolades of late, a number of awards from various people recognizing the excellent care that's provided here at Eisenhower. And that couldn't have come at a better time in terms of really, again, boosting morale of the staff to be recognized for the great work that they do every day, regardless of whether there's a pandemic going on or not.
Well, congratulations. Is the hospital doing anything differently in anticipation of the upcoming flu season?
We are certainly looking right now at how we're going to test patients, for example. There are tests available and more coming online as with each passing day, where we can potentially test for not only COVID, but also flu simultaneously. So rather than having to swab the patient multiple times to try to rule in or rule out, do they have the flu? Do they have coronavirus? Do they have some other virus? We're hopeful that we're going to be able to test them hopefully with one single test and have multiple diagnostic modalities within that test to understand what may well be going on with them. And so we just had a discussion actually this morning, beginning to really lay out the steps, the logistics behind how we would test patients for respiratory illness during a time when flu becomes a real potential issue. Whether we'll have a big flu season this year obviously is the subject of a lot of debate, because if people are socially distancing, wearing masks, and if we don't have the kids in the classroom, for example, then theoretically we should not see a lot of flu this year. But that obviously remains to be seen, so we're trying to prepare for that as well.
All right. Dr. Williamson, we appreciate your time. Good to see you again. Thanks for joining us.
Thank you very much, Peter.